I'm Dr. Olafur Palsson, and we'd like to ask him some questions about hypnosis. Good morning.
Good morning.
The first question I'd like to ask is simply, what was your first introduction to hypnosis?
Well, I started out in medical school many years ago in Iceland. I'm a clinical psychologist now, but initially I wanted to go into psychiatry. And in my first year in medical school, there was a psychiatrist who had a great deal of experience with clinical hypnosis, and he introduced hypnosis to the medical students, and I was quite impressed with some of the demonstrations, and especially his ability to create some physiological changes with hypnosis. So that stayed with me, and I always wanted to study that further. And when I switched to clinical psychology and eventually went into a doctoral program in clinical psychology, that was one of the first things I sought out, learning more about how to influence the body with hypnosis.
Could you share with us some of the influences, some of the mentors and people who have influenced you while you've been involved with hypnosis?
Well, I think my primary influence, the greatest influence, was working with Ian Vikram. Ian Vikram was the director of the behavioral medicine clinic in Norfolk, Virginia, at Eastern Virginia Medical School, and I got an assistantship there to study with him during my doctoral program in clinical psychology, and learned a whole lot from him about how to use hypnosis specifically to influence physical functioning. And the beauty of that was that he had a very sophisticated physiological monitoring system, so we could actually see the changes happening. So you learn to observe and objectively document the physiological changes that you were producing. And this had a huge impact on me. And he also had some other very profound effects on my whole view of how to approach hypnosis for behavioral medicine purposes. For example, he had studied and written a lot about the placebo effect and how to maximize the placebo effect as a necessary ingredient in making an effective change that was both profound in scope and would last. And he set up his whole clinic so that it was designed to maximize the placebo effect and instill faith in the treatment. And I always remember him telling me that if you were not showing your degrees on the wall, for example, just as a small example, then you were not giving your patients their money's worth, because you needed to give them the foundation of credibility and faith that was needed for them to make use of the treatment. It was not what created the change, but it was the necessary foundation to make them be able to accept this kind of treatment that is still somewhat far out in many people's eyes.
Could you tell us some of the applications of hypnosis that you've made since learning these techniques? Well,
I've always focused on behavioral medicine applications, that is, trying to address physical symptoms and improve physical health and well-being with hypnosis. And I've both done that generally with various problems like back pain, headaches, and so on. But after finishing my doctoral program up in Virginia, I was able to get a 2-year postdoctoral fellowship in behavioral medicine at the University of North Carolina in Chapel Hill under Dr. William Whitehead, and he is one of the foremost experts in the world on how the mind influences the gut, gastrointestinal functioning. And we started doing work on using hypnosis for irritable bowel syndrome, and we finished one study there, and later on, when I became the director of a behavioral medicine clinic, actually the same clinic that Dr. Vikram had previously directed, I focused more and more on GI problems, and partly because our first study has been well publicized, so people knew about it, and gastroenterologists started sending me more and more patients, and I kind of drifted into GI hypnosis more and more. And that continues to be my main area of interest, and it is remarkable that hypnosis treatment is perhaps the most successful treatment for severe irritable bowel syndrome, more successful than any medication, and more successful than other psychological treatments, except perhaps cognitive behavioral therapy. And that is what is attractive to me. This is one rare area where you have the most effective treatment with hypnosis for a medical disorder. And what we need to do now is to document that better. There is no question that it is this effective. The great majority of patients really improve from this type of treatment. What we need to do, though, is to do the same kind of thorough scientific work to document that and establish that as an effective treatment, as is done with pharmacological approaches and other mainstream medical approaches. So that is the goal. The goal is to lay the foundation for this becoming a mainstream clinical application for irritable bowel syndrome, and perhaps other GI disorders also. So I've kind of painted myself into a corner in a way, focusing so much on GI problems, and I'm now a research associate at the University of North Carolina in Chapel Hill again. I moved back down to North Carolina to work further with Dr. Whitehead, and we focus almost exclusively now on functional GI disorders.
Have there been some changes in the use of hypnosis that you've observed during the time that you've been practicing?
Well, I don't know if the changes were so much in the field as they were in the kind of approach that I have learned, because I came originally from a very kind of old-fashioned medical approach to hypnosis that was fairly rigid, fairly authoritarian, and was essentially the research school of hypnosis. I've kept some of that. I like some of the firm structure of the hypnotic intervention. However, as I have gone to meetings and workshops over the years, I've picked up kind of a mixed bag of other approaches that I blend into it now. So I think that the hypnosis approach that I use now is more permissive, and the approach is more indirect to some degree than it was before. However, the main frame of the hypnotic intervention is still kind of old-fashioned, the research approach, because I'm very adamant about documenting exactly what you do and being able to demonstrate that this can be done in the same way again and again. And that is very hard to do when you use the type of approach that lends itself uniquely to each person's characteristics.
Could you share with us your own understanding or definition of hypnosis?
Well, that is probably also rather old-fashioned. I think I would define hypnosis as an altered state of consciousness that is associated with narrowed focus of attention, greater openness to suggestion, and this unique feeling of automaticity of things happening by themselves. I think those are central characteristics of hypnosis, but it's also important, I think, to define hypnosis in terms of what happens as a result of these things, which is there is greater access to emotion, greater access to memory, and you can create more physiological changes, more changes in emotion, behavior, and cognition than you can in the ordinary waking state.
Finally, could you share with us a favorite story you have related to hypnosis?
Well, I don't know if I have a favorite story, but since we were talking about the kind of standardized treatment of IBS, one of the things that happened when I was developing the standardized treatment protocol for IBS was that people insisted that we would try this out on a few patients to begin with, and see if this type of word-for-word treatment, where everybody gets exactly the same treatment, really works. So I was assigned a room to do that at the hospital at UNC Chapel Hill. I didn't know it, but that room was right next to the heliopad where the Medivac helicopters land, and I was testing the third session in our protocol, and just as I was saying, notice how quiet everything is. There is not a single sound anywhere to be heard. The helicopter arrived, and it was so loud that I couldn't hear myself, so I had to shout these words, and I had to shout, notice how quiet everything is. And it felt really ridiculous, but I was absolutely stubbornly determined to continue with the protocol as it was, even though it sounded very stupid at the time because there was so much noise. But after the session, as I aroused the patient, and from the hypnosis, he said, this was the most beautiful experience. Everything was so peaceful and quiet. I've never known anything to be so quiet before. And I said, sorry about the helicopter. And she said, what helicopter? And then I went back to them and said, well, obviously this works pretty well, even though it is just a standard test protocol. We get them into the state that we want them.
Well, thank you, Ali, for sharing that story, and also thank you for spending time with me today to talk about some of the background of hypnosis. And hopefully they'll be able to get this to other people and then enjoy it also.
You're welcome.